Once again, everybody, thank you for joining us. Today's May 28th, 2019. It's a PEMF, Earth Pulse PEMF training webinar. Now, PEMF therapy for fibromyalgia. Many people have fibromyalgia. Some people have fibromyalgia. Some people have been diagnosed with fibromyalgia, but it might be something else. Do you often complain of a widespread pain that affects nearly all of the body, but particularly in certain areas like the back or neck? Have you become more and more sensitive to pain? Are your muscles and joint stiffness usually worse in the morning after you've gotten a good night of rest? It is common for you to bear unexplained and extreme fatigue. If you have all the characteristics mentioned above, it's a great possibility that you're suffering from fibromyalgia. Fibromyalgia is a long-term condition that causes pain widespread in the body. People with fibromyalgia have abnormalities within central brain structures that normally deal with pain sensations, thus increased sensitivity to pain. Now, there are also other common symptoms of fibromyalgia from which you can further judge if you have fibromyalgia. Sleep disturbance. Due to the pain, it may be difficulty in falling and remaining asleep. Cognitive dysfunction. Patients with fibromyalgia may experience cognitive disturbances and memory loss, which result in problems in learning, attention span, multitask, concentration, and even speech. Now, that could be many other things too, but these are kind of multiple symptoms that could lead you in the direction of fibromyalgia. If you have IBS, irritable bowel syndrome, that may develop or worsen in fibromyalgia sufferers. Sensations in the fingers and toes, of course, that might be neuropathy, but palm of hands, soles of feet, fingers, and toes are often along with tingling, numbness, prickling, and burning sensation. Others, depression, anxiety, temporomandibular joint dysfunction, that's like in your jawbone where the temple and the jaw comes together, also are signs of fibromyalgia. How does PEMF therapy and does PEMF therapy reduce fibromyalgia pain? PEMF therapy has been proven to be effective on pain and is particularly effective at enhancing sleep, relieving stiffness, and improving flexibility. This is why PEMF therapy has become welcome to the researchers as well as patients that are seeking alternatives to pain medications. Many individuals with fibromyalgia have poor circulation, but studies show that PEMF therapy can increase blood flow as well as increase oxygen levels in the tissue and improve the lymphatic system. If the tissue does not get enough oxygenation, it will die and then lead to necrosis of the tissue. Blood vessels deliver oxygen to the cells, and they also detox, help remove the waste. PEMF therapy can stimulate the blood vessels to carry plenty of oxygen to the cells and tissues, leading to a proper function circulatory system to reduce swelling and pain. The healthier the cells, the better your overall cellular function and motor function will be. Now, here's the fibromyalgia therapy protocol. Remember, our objective is to permeate the cells and increase blood circulation. Start with mapping out the affected areas that are chronic, and then we start with the ring off to cover a large tissue area. You want to start with 9.2 hertz for about 2 hours. Then follow with the recover mode for about an hour to 2 hours, depending on how much time you have to dedicate to it, ending with 10 hertz for 1 hour. At nighttime, you can use 2.6 to 6 hertz on the overnight mode for 6 to 8 hours, starting at 70% power pulse, and then you want to increase it to 100% power pulse within 2 to 3 days. Now, like if you have lower issue, like in the lower back area, even up in the shoulder area, 2.7 hertz is in the delta range, and then 6 hertz is up there. You can still sleep with 6 hertz running. The recover mode is you can run the recover mode if you've been using your Earth Pulse and you are getting good rest with the sleep programs. Try the recover mode one night, because the recover mode runs from 9.6 down a little bit, then up to 10.1, 10.5, and then down to 9.6, and it throughout the entire night. So recover mode is good for long term. And if you're sitting around, you know, on the couch or in the chair, or you can put the magnet behind you and run the recover mode during the day.